Pelvic inflammatory disease, or PID, is an infection in women which has spread to cause infection around the womb, the fallopian tubes or ovaries. It's usually caused by an infection which has travelled up from the vagina and cervix. It can be caused by sexually transmitted infections, but other bacteria, some of which can be found naturally in the vagina, can also cause it too. Pelvic inflammatory disease is more common after a procedure, for example, a coil fit or a termination. PID can cause a range of symptoms. Usually it causes tummy pains, and this can often be worse with sex. You may also notice a change in your discharge. It may be more of it, or an odour, or a change in colour, or sometimes a change in your bleeding, for example, after sex or between your periods. PID can be a difficult diagnosis to make, but if you're worried about this, it's really important to speak to your doctor or nurse. They will ask you some questions to take a history of what's been happening and also examine you. Because it's a difficult diagnosis to make, we often have a low threshold for treating for PID and giving antibiotics. The treatment is usually a 2-week course of antibiotics. It can also be sensible to rest and to take simple painkillers such as paracetamol whilst you're on this treatment. Rarely, it can cause a more serious infection, and this might need treatment in hospital with antibiotics through a drip. Whilst you're being treated for PID, it's really important to avoid sex and until your partner's had some treatment too. We usually recommend to come back at 3 days if you feel your symptoms aren't getting any better, and also to see you again at 2 weeks to see how you've got on and see how you manage with the treatment. It's really important that PID is treated properly because we know that if we don't treat it, it can cause long-term problems in the future. For example, problems with chronic pain, ectopic pregnancies, or even infertility. If we treat it properly and promptly, then the risk of these is much, much less.